I became a nurse, partly because of my own personal experience in the health system when I was a young child. I loved the diversity of nursing and just how many different areas there were. So right now I am in palliative home care. So I go to people's homes that have a terminal diagnosis or a life-limiting diagnosis and then meet them where they're at, whether that's beginning stages, still undergoing treatment, or if that's end-of-life care. There's stress involved in any aspect of the nursing spectrum. This job, I really enjoy it. I don't find it as stressful as some other ones because I know the expectations. You're going in to provide what they need in that moment. So I think every nurse could probably say that they've felt undervalued or disrespected as a nurse. I think unfortunately it goes to situation on where you're working, on whether it's a lack of training or a lack of resources, be that from the top down, or if it's just that you're working short-staffed. Mental health is extremely important, I think, in society in general these days, but especially for nurses. Oftentimes, it's seen as one of those professions where you just sort of carry on. Any other profession, you wouldn't expect somebody to work on a life or see somebody die in front of you and then just carry on with your workday and move forward. If you see a colleague struggling, or even if you're struggling and saying like, I need a minute or I need to talk about this, even if somebody might not be able to meet you where you're at, they're going to support you in finding those appropriate mental health services. Just because we can't see it doesn't mean that it's not there, doesn't mean that it's not important. If you take care of your mental health, everything else will follow from that. I find it's one of those things where it's just sort of a reminder to ourselves to encourage our colleagues and encourage yourself. Even if nobody else is clapping for you, let's clap for each other and let's really stay strong and just encourage one another, because that's important.